Hello and good morning. My name is Dr. Romina, and back with me every Wednesday, we offer you classes and trainings, and basically what you would ask me as a patient, I will be delivering to you on this webinar. Hopefully, these information are effective for you, so you have a better health and have a healthier life. Today is really for parents or for anyone who wants to know, do I really have scoliosis? Do I not have scoliosis? Is this something that I'm born with? Is this something I'm not born with? So let's go ahead and find out about scoliosis and what's the big deal about scoliosis. Okay, so this is part 2. If you haven't watched our first episode, please go to our website, BAX-U.com. It's right down here, BAX-U.com. And let us share with you some good words of health and wellness and prevention. All right. So what exactly is scoliosis? Scoliosis, hyperlordosis, hyperkyphosis. Hyper means more, and lordosis means more curvature in your lower back, and hyperkyphosis, kyphosis is the curve in the middle of your back. See, when you're born, when you're a fetus, like in this baby right over here, you're born with a C spine. It looks like a C, very perfect C. And then as the baby is born, you have a little bit of a low back curve. That's why they can hold themselves up. Then they're able to sit. When they sit, well, actually when they start crawling, that's when the curve of their neck starts developing. When they're sitting, the curve of in their lower back develops and the sacrum. And as they become adults and then the adolescent, the full spine is growing. Now, what's important is your spine needs to stay straight and it needs to stay aligned. Any deviation from side to side is called scoliosis. Any deviations from front to back is called hyperkyphosis, hyperlordosis. And they're really names of the curve. So the curve of the lower back, the lumbar, we call it lordosis, and the curve of the middle back, which is your thoracic spine, we call it kyphosis. All right? So here we go to the next one. How do we identify if scoliosis, what kind of a scoliosis we have? So in the clinic, we typically take it based on the 3 axes of motion, right? So we draw a plane that's right, dissects the body into 2 parts from side to side. Then we draw a plane from here, where we call that the coronal plane, where you move side to side. And we call that the transverse plane, the one that divides the body into half, where you rotate. Because every movement in your body, whether it's your shoulders, your head, your neck, your lower back, every joint moves in these 3 axes of forward bending and back, side to side, or rotation. So based on these, we identify, okay, how is the skeletal system and the muscular system reacting to the body shifting? So these are the planes. And when we look at a child or when we look at a patient that's in the clinic, we want to know, why is this a scoliosis? Why is there scoliosis? Is it they have hip issues, knee issues, ankle issues? What are the signs that you know or you may have scoliosis? So do you have frequent falls? Or does your child have frequent falls? Does your child find yourself to be clumsy? Do you have pain mostly on one side of your body, especially in children? It's very easy for parents to think, oh, my child has growing pain. Growing pains are bilateral. They happen on both sides, or they alter within a very short period of time. You don't have a consistent one-sided pain. So if you do have that and you have clumsiness and you do have poor posture and you just have a more flaccid body that doesn't stand up straight and just slouches all the time, your child or yourself are at risk of scoliosis. And it's so important to get this corrected because early detection can make a huge difference. Huge, huge, huge. So imagine you have a leak in your house, and if it's not properly taken care of, guess what happens? That's right. It can cause consequences. So is it a scoliosis? Is it a kyphosis? Is it a lordosis? What exactly is this? Scoliosis is when there's an unusual sideway turn. That's a shift in the coronal plane. So, and that you'll notice that you have more of a central pain, or you have pain on the right hip that affects your left shoulder, that affects your right head, or right hip, right knee, left ankle. So it goes in zigzags. And lordosis and kyphosis is more from the side view. Where is your head? Which a lot of you are probably seeing this when you're standing in line to get coffee, or when you are looking at the Gen Zs, they typically have this forward head position, which is causing a lot of problems with hyperkyphosis, forward head carriage, text neck are very typical of those. But another most important thing that you can identify, if your scoliosis, if your child's scoliosis is congenital, which means that they were born with, or if they were not congenital, that they developed it later on. Those are the things you can test at home, and we can go from there. All right, here we go. Next slide. So, did you know that if you do have scoliosis, the rest of your body compensates? So if there is a leak, if there's a weakness in a certain part of the body. So let's say that your child or you get frequent sprained ankles. The ankles are weak. The rest of the body sits on that ankle. So if one side is more weak, the body tends to compensate by leaning their weight on the other side. But if you keep moving to that side, you're going to fall. So an innate intelligence, neurological pathways cause the rest of the body to shift the other way. That's why it always works in zigzags. So very important to check the feet and also check the whole kinematic chain, right? I did want to mention this to you because how it manifests itself is by stiffness, aches, your clothes are not fitting properly, you notice that the zipper of your pants is shifted to the side, you notice that the hemming of your skirt or your pants are different from one side to the other. You notice that your shirts are not properly sitting, your collars or your buttons shift. If that is the case, most likely you have a compensatory shift in your body. So those are little tidbits that you can look for. The next one that I wanted to go over with, this causes compensatory scoliosis as well. You see, your head weighs about 8 to 15 pounds. So when your head is properly sitting on your shoulders and follows with the rest of your spine, when you're in a perfect position, and I know some of you are already starting to straighten up your body, there is zero amount of pressure and perfect distribution of weights along your body. There's no overload, there's no muscle spasm, there's no tightness. But as soon as you drop your head forward by about 30 degrees, which is almost about 2 to 3 inches, there is about 18 kilograms, which is equivalent to, I think, double and a half it, 2.25. You're looking at about 36, 42 pounds. That's pretty scary, right? Then you go higher, it's 45 degrees. Now, look at the spine during this time. If you notice, when the head moves forward, the middle of your back protrudes backwards, which we call that hyperkyphosis. But look in the following picture, what happens to the lower back? Do you see that how the body is compensating just because? So I was at the restaurant the other day, 2 days ago, and I saw this couple walk in, and the whole time, this was the guy, and this was the girl, just putting her phone on the table and playing with it. And the couple, the male part, was just hunched over. I think he was watching a sports game or something, or keeping track of something. But the worst thing is he was sitting with over 70 degrees of hyperflexion in his upper back and affecting his lower back. Now, for a 20-something-year-old to sit like this, it's devastating when they're in their 40s and 50s. So don't be surprised, especially if you have parents, if anybody who's watching who have a child with some form of shyness or a little aloofness or or maybe some emotional issues that you want to deal with, poor posture can cause a psychosomatic problem or somatopsych problem, which means that physical body is affecting the overall mental status. So changing your posture is not just about looking good. It's about getting into that mental state. And as Tony Robbins says, change your physiology and you will change your emotional state, and you can accomplish anything you want. Things that causes compensatory scoliosis are birth process, right? So I want you to pretend to take your hands, put them on top of your head, push down with your hand and push back with your neck. So if we push down and push up, you will feel a little bit of discomfort at the base of your head. During the birth process, the child's head is turned as the baby's trying to enter the canal, and we're trying to pull the baby. The two resistive forces can cause the upper cervicals to go out of alignment. In those type of kids, creating a lot of ear infection problems, colic issues, difficulty sleeping, breathing difficulties, allergies, later on headaches, and possibly scoliosis. So make sure you get checked with a chiropractic that does pediatric chiropractic. Childhood falls. It's very typical for kids to fall. Overexertion in sports. So when you push your kids too much, they fall, they get up, they run again, fall and get up. And if they are not checked, their spine will grow crooked. Repetitive slouching is also another factor. Beanie bags, I think, are the worst possible thing that you could have, because beanie bags on a laptop or a smart device is going to be a disaster for your spine. Also, obesity. Obesity overloads this musculoskeletal system of a growing child, and it will alter their posture. As you have noticed, probably people with obesity, if you have noticed, they have a forward head position and a flat back and a flat lumbars and a flat glutes. Those typically are caused by forward head position and abdominal muscles, which causes a lot of effect on their legs and their feet and their ankles. So this is the future consequences of bad posture. If you look at the pictures over here, they show you the rate of damage. Now, poor posture, just like bad breath, is the expression of a poor spinal hygiene, which means that if you do not fix this, it will become a big issue. Your spine is like the axle of the car, except instead of being one solid rod, it's made up of 3 curves. Now, instead of being one solid rod that has 3 curves, it's made up of little parts connected together, which we call these vertebrae. The reason being is that you need to have dynamic architecture in your body in order to be able to move in every single aspect possible. So you lean back and pick up a cup of coffee, and you twist and curl in order to be able to get your shoes or your socks from under the bed. So all those contortion movements are allowed by your joints, and it is possible to do that. However, when you fall and you injure yourself, or in scoliosis, 2 or 3 of these shift out of their normal position. So these bones, instead of being aligned, they become shifted. Then the segments above and below start compensating to accommodate for that. Symptoms: headache, backache, body ache, muscle fatigues, relentless pain that's not going away, and worst of all, you keep massaging it, and guess what? It will come back again. So it's time to get it checked, and if those are not indications enough, right? Now, what are the solutions you can do at home as a parent? So what I can teach you to do at home without coming to the clinic is this. What is normal? Let's figure out what normal is, and then we go into different types of abnormal, and we'll give you surveys or kind of screenings that you could do at home. And at the end of this webinar, we do offer a survey. Please take it. This will just give you your own score. This is something we do in the clinic. You could do it yourself. Check it off. We'll get the results and we'll know where you're at and give you proper instructions, okay? And there is no charge for this. This is really our community service. I do this on a regular basis because I might not be in your geographical area for you to see me, but that doesn't mean that I cannot help you. So let me see what I can do in order to help you have a healthier life for you and your family. So what is normal? Normal is when there's a normal alignment. If I draw a straight line from your forehead, nose, chin down through your chest, in between your legs, right by your feet. Your right side should balance your left side. How does that work? You check the earlobe, check the shoulders, check the position of the waistline, check the hips, the knees, the kneecaps, the ankles, especially the inside of the ankle where it's pointed, and also we call them malleolas, and also the arches of the feet. So they typically should all be in one line. If they're not, and if they're dramatically different, you got to get it checked, which is the next screening. Then from side, you need to do a lateral view. We call this plumb line. It's very much the same plumb line verbiage lingo that we use in construction, which means that if they're properly positioned, they have a least amount chance of injury or failure or weakness, right? So if you want that for your home, you definitely want it for your body, because you definitely can change your home, but you cannot change your body. You got it, so let's fix it and let's keep it in perfect health and harmony. All right, you draw an imaginary line from the earlobe through the middle of the shoulder, through the elbow, side of your hip, side of your knee, and down to your ankle. This is the perfect position of alignment, muscle at its optimal function, and perfect way to grow, right? Now, what is a home screening? When you check for scoliosis, it's very important to identify if it's muscular or if it's skeletal. Muscular is, and also importantly, if you were born with it, you were not. You have your child stand in front of you with a bathing suit and have them bend forward, touch their toes to their comfort zone, and check the spine. You should see the spinous processes of the spine, which is the vertebrae, the extensions of the vertebrae. They all should align and line up. So you can actually connect the dots together. Now, if the rib cage starts poking backwards as they bend over, and if you look in the bottom picture, that is a positive Adams test. It's a home screening to tell you that your child was probably born with scoliosis. So what does that mean? When a baby is growing into the mother's womb, the spine is like a salami. It slices as the baby grows. Sometimes it double slices, sometimes it skips a slice. That is either bone fusion or extra vertebra, which we call lumbarization, or it's extra vertebra for the sacrum, sacralization. It could be also spina bifida. That means the formation of the bones to create that indents in the back of your spine that you can feel. They were not properly connected together. It's a simple way to measure, was the developmental stages of the bone in the spine correctly done in the time manner of 9 months, or was it not? If it was not, the treatment process is going to be very different versus if it was. So what are the degrees of scoliosis? Let's say, okay, you have to recognize this. Anything between 5, some doctors say 7, some doctors say 10 because of the technology affecting our whole spine. But somewhere between 5 to 20 is an early stage of scoliosis, which means that therapy, exercise, proper conservative care is going to be ideal type of treatment. At this stage, we are not looking at surgery. Phase 2 of scoliosis is when the curve is between 25 to 45. This is a probability that that person is a candidate for surgery. But what are the most important factor is that the nerves, the bones are pinching the nerves that are feeding to the organs and as the nerves that come out of the spine, when they get pinched, they can affect the digestive tract, they can affect the reproductive organs, they can affect the heart, lung, and respiratory structures. So this phase is very important. Scoliosis is important not because of its aesthetic damages, not because of the early degenerative joint disease, but because of what it does to the organs of the body. It affects something that's not even attached to, which means pinches the nerves and the life flow that goes to your organs. Hugely important to identify scoliosis because you can prevent a lot of damages. Then there's another, so the home screening, you do your for scoliosis and you make sure that if it's healthy, if my child or if my partner is healthy and if my partner is not healthy, to take immediate actions. So what do you do for kyphosis and lordosis, which are also considered form of scoliosis? So hyperkyphosis, hyperlordosis. If you look at the green body over here, these are the lines that I talked to you about. Forward head position, when the head drops forward, your upper back moves backwards, your belly goes forward, your pelvis rotates forward, and your knee buckles back. This is a progressive chain of hyperkyphosis, which means that your thoracic spine, your mid-back is causing this problem. Then you have another form of kyphosis lordosis. That is when the head is not that much forward, it's the pelvis. This is typically seen with people who tend to stand a lot. So they kind of drop their pelvis forward, lean their head and back. So any of you using standing desk, watch your pelvis. If you're putting too much pressure on your pelvis to get to your work like that, not good at all. You're already causing damage, which eventually can cause the side problems of posture will buckle up the spine into scoliosis. So next one, forward head carriage, the pelvis tilts backwards this time. Or you have the one that has the hyperlordosis, the totally too much pressure on the and have much pressure on the upper back. Problems spine, also known as adult onset giant 5-letter word that says, oh my God, my internet is unstable. That says, what? Guess what? This was caused by poor posture. Don't know where it came from, but there it is there, and it's right here to be treated. Okay. And what do you do for it? So you identified there is a problem. What do I do? There's 2 areas you need to fix: the bone and the soft tissue, specifically the fascia. So I was giving a presentation last time and somebody asked me about fascia. Fascia is, let me give you an example. When you build a bridge, the metals and the cements, the bridge itself would be the skeletal system. The tension cables that are suspending the bridge on the water, like a San Francisco Golden Gate Bridge, those are the soft tissue equivalent to the body. The balance between these tension cables are going to stabilize the structure. You cannot say, I can only exercise and fix this, because it's not going to happen. You cannot say, I'm only going to get adjusted and expect a correction of your spine. That's not going to happen. They go hand in hand in order for you to get the best results for your time and for your money. So have you ever heard of something called tensor gravity? Have you ever seen suspended structures, sculpture pieces? Okay. The balance between the front of the body and the muscles in the back, and the muscles on the right balancing the left, this whole dynamic, constant balance is what keeps you upright against gravity. So the tension that's placed on the muscles to hold us upright, they're constantly in fighting mode. So when a person has scoliosis, there's an interruption in the balance of the tensions, almost like what happened to the Golden Gate Bridge after the earthquake. Shifted, tension cables were snapped or weakened or overpressured, right? So your body does the same thing, and it works in zigzag. So when you are exercising a scoliosis treatment, it has to work on working the muscles contralateral. Don't expect to go to the same class that a normal person goes and get the same results. In fact, people with scoliosis and posture problem, when you exercise on an already existing problematic area, you make your problem worse, which would mean that later on it will cost you more office visits and it will cost you more time. So to avoid that, get screened, get checked, get it done right, so you protect your future to schedule your vacations rather than your doctor's offices. The other part is hard tissue. Hard tissue is addressed by chiropractic alignment. Your soft tissue is addressed by personal trainer, trained personal trainer in scoliosis, physical rehabilitation centers, physical therapists, chiropractors who specialize in spinal biomechanics or spinal correction. The rehabilitation program and the structural correction has to go hand in hand. I know there are some physical therapists that adjust. Chiropractors have been doing it over 100 years. They've been trained over 100 years. They've perfected the craft, and we hold each other accountable immensely. And I think working with a physical rehab specialist is going to be very beneficial for you. So be careful of your choices. But there's other choices too. You can buy braces, you can check your ergonomics, and you can check the way you sleep. These factors are going to avoid aggravation. But before you purchase a brace, let me tell you, you see that picture? I'm sure any of you have seen it on Google search or Amazon search. That brace is the worst brace you could buy. Why? First of all, it compresses the armpit. There's a group of nerves that come out of your neck that run through your armpit, go to your fingers, these three, these two, these three, and these two, right? So they call them brachial plexus that run through your armpit. When they're compressed under the armpit, they aggravate the problem. So you're trying to fix your head, you damage something else. You're trying to fix your posture, you cause a compression on your nerves, which is by far more damaging. However, the pictures look beautiful, the models are beautiful, but the product is extremely damaging. So quality control your investments to what works for you. I went to junior high in England, and what I learned from the British was that I'm not rich enough to spend money on cheap stuff. So take care of your body because it's the only thing you have, and invest in it wisely. That's all I can say. So we recommend BAX-U because BAX-U has been tested in corporate wellness. It has been tested by University of Michigan. It is approved by your flex spending account, HSA account, FSA, HSA account, and your PPO insurances. It specifically does not, can I just show you over here, compress your armpit, period. Because compressing your armpit aggravates your nerve structure. And being designed by a chiropractor, all those factors are taken into consideration because the whole purpose is to help you not make it worse. So if you have children, you have loved ones that are slouching or they're starting to slouch, put a BAX-U on them. Get them upright, make them exercise in an upright position. So that way that forward slouching does not cause the spine to buckle to cause a scoliosis that they were not even born with. So the benefits is retracts your shoulder and it dials your system back. It stabilizes your back and it comes with a free mask, so which is really good at this time, right? My name is Dr. Romina Ghassemi. I look better in that picture than I do here. The lighting is not that great, but if you have, you tell us what would be your next title that you want us to have. My goal here is to help you, educate you, train you, teach you, so you make decisions for your family out of awareness and knowledge rather than not knowing and asking a lot of people who also don't know but are heard from someone. So you heard it right here. My name is Dr. Romina. This episode is also posted on our website, so you can rerun it, you could learn it again, watch it again. Please share with your friends and family because if I can't reach out to them, you can, but hopefully we'll save a spine. Just on a side note, lumbar spine or lower back scoliosis is a pelvis shift in girls, which is more predominant in girls, would cause fertility and uterus problems and digestive problems. So let's help a family doesn't have to go through the costly expenses of the future damages of scoliosis and save a life together. Thank you and have a great day. See you next week.